I am going to share a little bit about our speakers. So Laurie started working as a Medicaid Waiver Care Coordinator in 2009 and has experience working with Medicaid in 3 different states. She has a broad knowledge about the Medicaid system, how it's designed, and solid ideas about how it should be improved. Jennifer Williams has been employed since she was 10 years old and worked in a variety of settings and is now an in-home healthcare worker specializing in Alzheimer's and dementia. Jen is passionate about advocating to break down Medicaid barriers to enable immigrants, the elderly, and the specially abled to have access to the care they need and deserve. So thank you both so much for being here. This is one of our series of conversations that we are going to have as we move forward. And so giving a short introduction is Sarah, who is a research analyst with SEIU 775. She was born and raised in Anchorage and moved to Washington. Sarah's passionate about labor and environmental issues and is excited to be working to advance better working and living conditions for caregivers and clients in Alaska, Washington, and Montana. So Sarah, go ahead and take it away. You're going to share a little bit about the situation in Alaska, specifically around senior caregiving.
Wonderful. Can everybody hear me okay?
Yep.
Hi, so happy to be here. Thank you for the introduction. And thank you for inviting me here to help frame this really important conversation. Though I currently reside outside of the state, Alaska will always be home, and I want to see our people and communities thrive. As many of you know, Alaska has the largest percentage of seniors of any state in the country and one of the fastest growing populations with dementia. At the same time, there are fewer working age adults available to work as potential caregivers, and this care ratio has gone from 15.9 in 2018 and is projected to be just 7 in 2030. As I'm sure you'll hear from the stories of caregivers on this panel today, caregivers in Alaska are facing a number of challenges to making a living doing the work they love. While caregivers leave the field because they can't afford to stay in the job, that makes it harder for seniors and people with disabilities to find care. And of course, the challenge is even greater in villages and off the road system. PCAs or DSPs often face irregular and undependable hours due to budget cuts and service level reductions. Wages are low and in fact have gone down over the last 10 years, despite this being a physically and emotionally demanding job that has only gotten harder with COVID. And of course, there are no benefits like insurance and healthcare. The vast majority of care work is done by unpaid, untrained friends and family caregivers. AARP estimates the number of unpaid caregivers to be around 85,000. The state's reliance on unpaid care means that people are pulled out of the workforce to do free labor. This disproportionately impacts women and women of color and immigrant women in particular, who bear the brunt of most care work, paid or unpaid. This creates a cascade of issues that make it harder for families to achieve stability and security. The clear path forward is to fairly compensate caregivers for their labor and to make it easier for family caregivers to get compensated.
Thank you, Sarah, for framing the space and the box within which we're having this conversation here today. So we're going to start with Laurie. Laurie, you have a huge amount of experience in multiple states, and you have some great ideas and are really great at educating as well and explaining kind of what's really happening from the perspective of someone with lived experience in this. So what is it that you are seeing as people are coming into needing Medicaid? What's going on as people realize that they need Medicaid, and what's your experience with that?
I specifically help people apply for Medicaid for the Medicaid Waiver Program. And so it's at one of the medical Medicaid programs that has the medical component. So they have long-term care needs, and they're choosing to receive those services in the community or at home due to certain medical conditions. And you know, for me, when my clients come to me, they usually have had a significant change in medical status. And so, you know, they're in crisis. They're trying to figure out how to continue and how to get these services that they now will rely on for to live and be healthy and safe. And I have helped people with regular Medicaid. Actually, when I was a Medicaid caseworker, I was people applied for regular Medicaid with me specifically, family Medicaid, regular Medicaid, elderly and family Medicaid. So they too, it was often a desperate situation. They needed medical insurance, they needed care for their children, or they needed care as they were aging. They needed health care. So, I've always said, if a person is eligible for Medicaid, they're eligible, if they need it, they need it. So it's there. It's a program available in all of our states. And it's very important because, it's usually people who are low on income, or they have significant medical needs that need to be addressed and they need care for. But the problem that is always a situation is that it takes a really long time to get Medicaid and to even find out, how to even start, where do you go? Who do you call? Do you go on a website? Do you go into an office? And like for the Medicaid waiver, you have to have a care coordinator, which is my role, to even apply for Medicaid. So, and then how do you know that, so whenever clients come to me, they always say, gosh, I didn't know this existed. I didn't know this service was out there. And I always say, well, you never do until you have to suddenly. And then luckily the right person told you that it existed and where to go. So, access, I think, is a huge problem. And obviously with that lack of information, I think it would be nice if, there was a commercial on TV, like, hey, contact your local Division of Public Assistance office and find out which programs you may be eligible for, or some literature that you could pick up, flyers. You see flyers around sometimes on Medicare or Social Security, but you don't really see anything on Medicaid. So I think that would be good to have a campaign of better awareness and access, and good customer service and treating people with dignity, and just being more supportive for the people who need the service. When people need it, it's often they're getting a crash course in Medicaid, and it's very complicated, and often there's several denials that occur before they finally, after potentially months, finally get qualified. And it's frustrating. Actually, a woman called me today, not a client, not applying for my program, but she was like, I don't know what else to do. Someone give me your name and number. She's working with a lawyer. She already has a caseworker who I know is a good one and has been there a long time, but she's still frustrated, doesn't know what to do. She's scared. She's freaking out. She needs Medicaid for her mom, and she's been working on it for months. That is the common theme. It's frustrating. It's always frustrating. You can't really communicate with people very easily. You can't just call someone on the phone or send an email. So that's a big deal. And then the fact that there are a lot of different types of Medicaid, and some of them that don't even count resources. If you have a medical condition, like if you're a child with certain medical conditions, you can get Medicaid without counting your parents' income. If you need women's Medicaid, they don't count resources for that. So there's a lot more availability. There's even the Magi Medicaid that they don't count resources, only income for people, I think, between 21 and 64, they can get Medicaid without, even if they have $100,000 in the bank. So if they're low income, they can get it. Yeah, and then really, like with my clients, I help people get in-home care services or assisted living. And honestly, like since COVID, when people have come to me and they don't want assisted living and they want to make it work at home, I have to tell them, frankly, that unless you have a worker already identified that's willing to get hired by one of these agencies and make less money than you would at McDonald's, you're going to have a really hard time filling your hours because all of the agencies lost tons of staff. I mean, we have 4 that serve Homer, and I call all of them, maybe once every month or 2 to see if they have any available workers, because we have lots of people with unfilled hours. And so if it's a new person coming and they need caregivers and they don't have anyone that can do the caregiving, I have to tell them, I'm sorry, but it's probably going to be difficult to fill your hours? And would you consider assisted living? Is there anyone that you can think of that would be willing to get hired to help you? Because otherwise you're only going to be able to get Meals on Wheels, and you're not going to have someone there on a daily or even a couple times a week basis helping you with your self-care tasks. So that is a problem, because caregivers who take care of our most precious people make very little money, and it's almost not worth it for people in this day and age when they can go get a job that's not as maybe difficult or intense or emotionally affecting, and they can just go do their job and be done and go home and get more money.
Oh my
Yeah.
gosh, Laurie, it sounds like you have so much experience. That is just, I think the thing that I really took away from that I didn't know is about the income, and the fact that there's actually not income requirements on some Medicaid. I think that's huge. I don't think people realize that. So that's really interesting. I'm sorry, Annette. I just had to.
Oh, it's
It
okay.
just, I know people don't know that. Like, I know
Yeah.
for sure people don't know that.
Mhm.
Right. Good. Yeah. Great.
Thank you, Laurie. Yeah, no, that's huge. Yeah, there's just so much to unpack there, but I'd like to move on to speak with Jen, because Jen, you're one of the people who actually left the agency to do private pay and work for yourself in the home care field, right? Can you tell us about that? You're on mute, just to let you know.
Are you sure I'm on mute? Am I
Not
still on?
anymore. You're good. You're good
Okay.
now.
Well, I noticed a rising need with people that didn't qualify for Medicaid, and they were needing help. They were taking care of their moms and dads and grandmas and grandpas, and they had absolutely no assistance. They didn't know who to turn to find people to come in the home and give care to their loved ones. And so when I realized there was a rising need for that, I decided to step up. And, I noticed that the wages were better in private pay because people really, really need help, and they're willing, to pay the wages that us caregivers that have been at it for a while deserve. And so I really started reaching out to people because I was getting calls like every other day, how do I get a caregiver without going through an agency, because my loved one doesn't qualify for Medicaid. And so I just saw an opening there and a need, and I really wanted to help people.
And so you mentioned the wages. And so was that a significant, I mean, it seems like that would be a significant factor in choosing to leave the agency system.
Yes. That, and then the flexibility. The agencies went to electronic time cards or timesheets, which I found to be very invasive. It kind of invades your privacy. They want to know where you're at all the time. And as you're busy trying to get to your client's house, you're having to check in. And the system for these electronic timesheets are very inconsistent, and people are getting delayed in payment. And I honestly just wanted to keep it simple, and I just wanted to get out there and help people, and and just do it the old-fashioned way, so to speak.
Mm-hmm. Yeah, no, that's great. And so, I mean, the part where the system is terrible is not great. Figuring out a workaround is what's great. Finding a way to be able to help people is what's great. And so you specialize in dementia and Alzheimer's. And so can I ask why or how you ended up doing that? That's a population that we have growing in Alaska, but it's a population that I think a lot of people are kind of hesitant to even go into. So that's your passion. How'd you get into that?
When I was 16, my grandma was diagnosed with dementia. Well, at first they diagnosed her with Alzheimer's, but I noticed that it wasn't getting worse as the years went by. And I'm like, well, maybe we need to relook at this. And they decide, oh yeah, she just has dementia. And, when you have a loved one that you care about and you see them literally, getting lost, hallucinating, essentially losing their mind, you want to know why, you want to know how, you want to know what can I do, and you want to make it as least traumatizing on them as possible, because they're going through huge transitions in their life. You want them to feel secure, you want them to feel safe, because it can be really scary when you have these diseases. And it's up to us people that care about them to make sure that they have that level of security. And so that's really what sparked my interest in researching what dementia and Alzheimer's was all about, is because of my grandma. And it just so happened, like, my first 5 clients that I ever had also had dementia. So I've got about 10, or well, since I was 16, well, I'm 47 now, so that puts about, what, 20, 30 years under my belt. But it's my heart, you know. And I, even though sometimes they're in a different world and every day is a new day, I'm glad to be a part of them feeling better about their journey that they're taking through dementia or Alzheimer's.
Well, thank you for that. That's an amazing story. It really is. Thank you. I was like, don't cry, Annette. Don't do it. So I mean, what I'm getting here is kind of from a systemic level. We've got folks that are waiting months, if not years, to get the supports that they qualify for and that are available. But even when they get the supports, in terms of getting the insurance, getting the Medicaid, getting the waiver, whatever they need, there might not be the people to fill the roles, in large part because of the pay, But, and then on the other hand, we have folks who are leaving the system, the agency system, to go into private pay to fill that need. And the result is that we've got folks who are waiting for services. We have folks who are paying out of pocket because that's all that they are able to do in order to get the supports in the home that they need today, in the moment, because that's still a better alternative than assisted living. That's like, and that's the state of things in our state with healthcare in Alaska. So, I mean, what can we do about that, in terms of getting some systems in place, or supporting some changes? I know, Erin, you were going to chat a little bit about some legislation that's coming forward. I think that's a great segue into, like, so now what?
So now
Erin,
what, right?
Yeah, now what?
for real.
Like, this is a big deal in Alaska. So Erin, talk to us about what's on the horizon and what can we do to change this? Because I want Jen and Laurie's life to be easier and not more difficult. And
Quite
so
frankly, I want my life to be easier.
and
because
our own lives, right?
I was going to say, I take care of my elderly parents in trying to find responsible caretakers through an agency is really challenging. It's very, very challenging. So I want to thank you ladies, first of all, for the work that you do. I don't think that I ever realized how much work it took until I had to do it. And I realized that this is a passion project, and you have to love it and love the people that you're working with. Because if it wasn't my mom and dad, I don't know that I could do it. And it's hard enough with it being my mom and dad, and I love them to Reese's Pieces. So, but there is some legislation coming down the pike that I think might help. And a couple of the things that I identified really with was that we need more caretakers. It is clear that we need more caregivers. I'm sorry, because they really give care. They're not taking care. So let's get the nomenclature correct. We need more caregivers, and we need to be paying our caregivers better, through whether it be through agency or not agency. We need to pay these people that are providing our loved ones with dignity and respect in their home. We need to be paying them according to the work that they're doing. And we certainly are falling down on that job as a state, as a country. The other thing that I heard that, I mentioned, it shocked me when we talked about it before, was that Medicaid is open to people that need it. It is needs-based, and need just isn't monetary. Sometimes if you're sick, Sometimes if you're, you have a child that has a certain disease and you can't fund it, you can get on Medicaid. It sounds like it's a hell of a process. And it sounds like we have some wonderful people that will help you through that process if necessary. So next steps is, first of all, I think we need to continue this conversation, and I would love to continue this conversation with you ladies. That's the only way we're going to come up with real solutions, is with real people that are really doing the work. This is one of the mistakes that government always makes, is it doesn't start with the workers. The solution should start with the people that are doing the job. That is what I have always found comes up with the best solutions. If you don't know what you're doing, if you're just making decisions from your perch in the legislature that nobody can get to, then you don't necessarily know what's going on. However, we do have two legislators that have brought a bill forth. It is HB 292. Let me get it right, because I did say SB 292 before. It's HB 292, and it's working its way through the House right now. And Rep. Liz Snyder and LV Gray Jackson have put forth this bill that will address some of the issues that we're having. Let's face it, one bill isn't going to fix this entire system, but it will help us keep and retain care workers, caregivers. I'm going to get it right. Care, love, whatever. I'm sorry. Caregivers will increase caregivers and make it easier to navigate some of these programs. And I can't stress enough how much we need to demystify the programs so that people can get the care that they need. Yes, it can be complicated. Yes, it can be a pain in the rear. But if you really need that help, sometimes you got to go through the process. And as you're going through that process, you can come into these spaces and help us to simplify those processes, right? So we want you to join us. We want you to follow Stand Up Alaska. We will, I'm going to go ahead and commit these ladies to saying that we're going to go ahead and do a Did You Know series and just highlight some of the areas where you might not know things about Medicaid or Medicare or caregiving in general. And so we're going to start a series on our social media called Did You Know? And we promise that they won't be long, but we're also going to continue these conversations. I know that we are scheduling an April event to do another roundtable with another group of care. And I'm not even sure, I know that they're in the industry, to talk about the issues that folks are having with getting their children into the system. So I think that should be an interesting conversation. We want you to email us at alaskanstakeastand@gmail.com. I'm going to say that again because it's all spelled out. alaskanstakeastand@gmail.com. We want you to email us if you have ideas or questions that you'd like us to try to get answered in these roundtables. We're going to be doing them monthly. And all around our state Medicaid system and getting it fixed. We're going to get it fixed, folks. And so stay tuned for that. And we also want to get some feedback from folks that are experiencing those barriers to Medicaid. We have a survey, and it's at medicaidbarrierssurvey.org. That's medicaidbarrierssurvey.org. And we're just trying to take the temperature and find out where are the gaps in our Medicaid system and identify those and help fix those. And that's what we're going to do. That's Stand Up Alaska is committed to making it so that if you have a healthcare emergency, you aren't scared that you're going to go bankrupt. That's one of our missions for sure. We're not exactly sure what that looks like, but we're in the fight with everybody Thank you, Annette, for pulling this together. You're amazing as always. I just appreciate everybody in this space so much. Sarah, thank you for jumping in and joining us and framing that perspective. We will definitely be calling on you further because things are moving so quickly and changes are happening, and we want to know what's going on in other states so we can pick up best practices, for not just Medicaid, but also for our care workers. So thank you for joining us. I'm done. Sorry for taking too long.
No worries. And Laurie and Jen, thank you both very much for sharing your lived experience and perspective. None of these changes would be possible without that. And so I do want to share that HB 292 did have a huge amount of stakeholder buy-in before it was created. And so that's one thing that's really exciting about it, is that the real tangible changes that it makes are based on the perspectives of people with lived experience. So we are a couple of minutes over. If folks need to go, you're welcome to go. If you're okay with waiting maybe 4 minutes, if there are any questions, 3 minutes, if there are any questions, then we can address them. Please go ahead and put your questions in the chat if you have any. But otherwise, have a lovely day, and thank you very much for joining us today.